When joints begin to hurt, many doctors simply offer temporary solutions. The pain may be relieved with creams or painkillers, but these methods only provide momentary relief without addressing the underlying cause of the problem. However, during the Soviet era, there was a little-known but highly effective system of exercises developed by Professor Dolenko. Although Dolenko never sought fame, his method helped thousands of people eliminate joint pain even when conventional medicine had already given up. This system was used in rehabilitation and also in the training of cosmonauts, with remarkable results. Those who were scheduled for surgery rejected it and soon returned to their daily activities without pain. Over time, the method was forgotten. The secret of Dolenko's gymnastics lies in activating blood microcirculation in the joints. The stagnation of blood in the small capillaries is one of the main causes of cartilage destruction, inflammation, and movement limitation. By activating these capillaries, the tissues regenerate, the pain disappears, and mobility is restored. All of this is achieved through natural and gentle movements without forcing the body. The key to Dolenko's method is that it offers a solution without the need for complex devices or medications. The accumulation of blood in the tissues is one of the main causes of joint destruction. With age and lack of movement, the capillaries stop functioning properly, limiting the nutrition of the cartilage, leading to pain and immobility. Dolenko's method activates circulation, allowing the capillaries to once again deliver the necessary nutrients. Through gentle, undulating movements, circulation is improved, spasms are relieved, mobility is regained, and natural recovery is activated. Unlike strength training, which can damage already weakened joints, Dolenko's gymnastics is suitable for those who have difficulty moving. It is important to understand that joints do not deteriorate overnight. The process is slow and almost imperceptible, which leads us to ignore the warning signs until the pain becomes evident. Some early signs that joints are not receiving adequate nutrition include morning stiffness and cracking or popping in the joints. When joints are healthy, movement should be as free in the morning as they are throughout the rest of the day. If blood circulation is affected, the body needs more time to activate in the morning, which indicates a problem in the capillaries. Frequent cracking can also signal that the synovial fluid inside the joint is decreasing or becoming thicker, affecting its cushioning and gliding function. Without synovial fluid, the joint surfaces begin to rub against each other, causing damage and thinning of the cartilage. The third warning sign is the feeling of heaviness and stiffness after sitting for long periods. After spending hours driving, sitting in front of a computer, or even watching a movie, it is common to feel that you have difficulty straightening up, as if your body were numb. This feeling is a direct result of blood congestion. Joints only receive nutrition when you move. If movement is limited, blood flow slows down, tissues do not receive enough oxygen and nutrients, and joint destruction begins gradually. Finally, the fourth and less obvious sign is the loss of mobility in the fingers. If you frequently work with a computer, phone, or engage in crafts, your fingers are subjected to daily strain. Try this. Squeeze and release your fingers 10 times in a row. If you notice that the movements are less fluid and feel as if the joints are stuck, this is an indication that the capillaries in the small joints are no longer functioning properly and need help. Professor Dolenko's method is based on surprisingly simple yet powerful principles. Active movements awaken the capillaries, activate blood flow, and fill the joint tissues with oxygen and nutrients, restoring flexibility and mobility. For the shoulders, Dolenko recommended starting with circular arm rotations, first in one direction and then in the other. These movements activate blood circulation, release tension, and allow for a gentle shoulder stretch without effort. It is also important to regularly perform a simple exercise to open the chest. First, bring your elbows together in front of you, rounding your back slightly, and then separate the elbows to the sides. Straighten your shoulders and gently arch the upper chest as if you were taking a deep breath. This exercise not only maintains shoulder mobility, but also improves breathing. Activities such as swimming, rowing, or even skiing further strengthen this area as they engage the muscles of the upper body and enhance blood flow. For the lower back, slow forward and backward tilts are especially helpful, as well as movements behind the head as long as flexibility allows. The professor also recommended gentle lateral tilts, first to one side and then to the other. Circular body movements performed smoothly and at a free pace produce excellent effects. These exercises strengthen the deep muscles of the back, improve flexibility, and maintain the health of the intervertebral discs, which is crucial for those leading a sedentary lifestyle. For the hip joints, Dolenko emphasized gentle and delicate movements that do not apply pressure on them. Some recommended exercises included light squats, circular pelvic rotations, leg swings forward and upward, and tilts to each leg, standing with feet shoulder-width apart and hands by your sides. These movements not only restore mobility, but also restore the nutrition of the joint tissues. The result will be more noticeable and lasting if factors that hinder recovery are also eliminated, such as a sedentary lifestyle, stress, and lack of micronutrients. It is precisely when Dolenko's gymnastics is combined with taking care of the body from within, proper nutrition, hot water treatments, and relaxing massages that it becomes an effective recovery tool and not just a temporary relief. Many forget that joints are living structures that renew themselves daily. The cartilage inside them doesn't harden permanently. Instead, it regenerates slowly but constantly. However, when the body lacks essential nutrients, the recovery process significantly slows down, which over time can lead to decreased mobility and increased pain. There are several products that not only help maintain joint health, but also accelerate recovery. First, gel-forming substances like gelatin, homemade broths, agar-agar, or seaweed are essential. These support the elasticity of the cartilage tissue and promote its renewal. Foods that improve blood circulation also play a crucial role: beets, garlic, pomegranate, cinnamon, and ginger. These help thin the blood and improve nutrient distribution to the joints. We must not forget omega-3 sources such as fatty fish, flaxseed oil, walnuts, and other nuts. These products help reduce inflammation and protect tissues from damage. And of course, water. Without enough liquid, the joints cannot function properly. If the body lacks water, the synovial fluid thickens, loses its cushioning properties, and cartilage wears down more quickly. In addition to nutrition, breathing also plays a key role, as recovery is impossible without oxygen. A simple breathing technique can not only relax the body, but also activate blood flow. Try this technique. Inhale slowly through your nose, counting to 4. Hold your breath for a few seconds and then exhale gently through your mouth. Repeat this exercise 10 times. Although it doesn't take long, it properly oxygenates the tissues, relieves tension, and improves blood circulation. It's important to understand that not all movements are beneficial for the joints, especially when pain is already present. Many people believe that if they feel pain, the joint needs to be more developed and overworked. Therefore, they go to the gym, exercise, and the pain only worsens. One of the most dangerous movements is the deep squat. Although it may seem like it strengthens the legs, in reality, when you go too deep, the knee joints experience excessive pressure, especially if they are already worn down. At that point, the cartilage tissue is compressed, the synovial fluid is squeezed out, and friction increases, accelerating destruction rather than restoration. Jumps, running, and any kind of impact are equally dangerous for the joints, especially when there's no cushioning. When a person runs or jumps on a hard surface, every step feels like a strong jolt that travels through the feet, knees, and up the spine. Asphalt, concrete, and tiles do not have the ability to absorb the impact. That's why, with every step, the joints receive a micro-impact that destroys them from the inside, especially if the cartilage is already thin or damaged. In such cases, even a quick run can trigger chronic pain. This is even more evident in overweight individuals, as the load they bear is much higher, making each movement a considerable effort for the joints. To reduce the risk, it's much safer to replace running with brisk walking, swimming, or exercising on special soft surfaces where the body receives the necessary load without destructive effects. Abrupt twisting movements are also dangerous, especially when they affect the spine. When a person performs deep stretches with pulls or twists of the torso, muscles and ligaments don't have time to adapt, creating excessive pressure on the joints and intervertebral discs. This tension can compress the nerves, causing microtraumas and inflammation. Instead, it's much safer to perform gentle, undulating movements that activate the joints without overloading them, allowing the body to warm up naturally without stress or risks. Weightlifting is worth mentioning. When a person lifts a heavy object, such as a bucket of water, a shopping bag, or a dumbbell, and does so without the correct posture, the joints bear an enormous load. The knees, waist, and shoulders are especially vulnerable in these cases. The problem is that we often perform these actions automatically. For years, we carry bags, lift heavy objects without brakes or control, without stopping to think about how it affects our joints. Then we wonder where the pain, stiffness, or tightness came from. To prevent injury, it's important not only to lose weight, but also to learn how to lift correctly with proper support, a straight back, and clear weight distribution. Only in this way can the joints handle the load without wearing out over time. Many people start exercising with enthusiasm, promising themselves that they will work out every day. However, after a few days, the enthusiasm fades. Some complain about a lack of time, others stop believing in the results, and some simply forget. It's okay, we're all human, but it's consistency, not motivation, that truly gives your joints a chance to recover. For the technique to truly take root in your life and not be abandoned after a week, it's helpful to follow some simple rules. Did you know that in addition to the exercises we've mentioned, the ketogenic diet can speed up the recovery of your joints and improve your overall well-being? The keto diet not only helps reduce inflammation, but it also optimizes cell regeneration and improves circulation, which is crucial for the health of your joints. By adopting this lifestyle, many have experienced a significant improvement in their energy, flexibility, and mobility. Don't wait any longer. Discover how the keto diet can rejuvenate your body and joints, and start enjoying a life without pain. Click the link in the description and watch the video where we show you the benefits of the keto diet and how you can get a personalized plan just for you. The transformation starts today. First, start small. You don't need to do the entire exercise routine immediately. Simply choose one easy movement that won't take more than a minute. Even a short practice like this will begin to change your state. And when this action becomes a habit, you can gradually add more exercises. Joints do not tolerate sudden changes. They need smoothness, rhythm, and gradual progression. Secondly, integrate it into your daily routine. There's no need to look for a special moment. Simply include the exercise in your daily life. For example, after washing your face in the morning, do a couple of shoulder movements. At night, before bed, do a gentle rocking motion to relieve tension. While watching a movie or the news, do hand rotations or finger exercises. When exercise becomes part of your daily routine, it stops being something extra and naturally integrates into your life. Third, don't expect immediate results. One of the main reasons people abandon exercise is disappointment. After a few days, if the pain doesn't disappear, the thought arises that maybe it's not working. However, joints recover slowly. Even if you don't notice immediate changes, the recovery processes are already happening inside you. Just trust your body and give it the time it needs. Lastly, feel comfortable. If you feel pain during the exercise, it's a sign that the movement is too abrupt or that your body is not yet ready. There's no need to force the joints. On the contrary, do the movements at a pace and intensity that feel pleasant to you. Listen to your body. It will always tell you when to stop and when to continue. If this video has been helpful to you, please give it a like and subscribe to the channel. Write in the comments if you've tried joint gymnastics. Wishing you great health and happiness. If you're ready to take the next step and transform your joint health effectively, don't wait any longer. The combination of exercise, healthy habits, and a proper diet like the ketogenic one can change your life. The keto diet not only reduces inflammation and improves mobility, but also accelerates the recovery of your joints so you can live pain-free. Click the link in the description, watch the video, and discover how the ketogenic diet can rejuvenate your body, enhance your flexibility, and bring you back to a life full of energy. Act now and begin your journey towards a healthier, pain-free life.